Most cancers are experiencing a big drop in the number of deaths, but one of the most common cancers among men is not. Talking about prostate cancer. Jesse Schultz is in the newsroom with more on this. Doctors think this troubling trend is happening. Why, Jesse?
Well, there are a lot of factors. A big one is men don't get screened until it's too late. Dan Chesson first noticed something was wrong the day of his son's graduation.
I hurt after that. It was almost as though I had been on a bicycle for a long, long time.
He went to his doctor for a blood test, and he was right about something being wrong.
Dr. Ponsky, in a very caring manner, said, "You have cancer."
He's among the hundreds of thousands of men diagnosed with prostate cancer every year. And despite years of declining death rates, this year, they are estimated to be the highest they've been in the past 20 years. Dr. Lee Ponsky, the chairman of urology at University Hospitals, says part of the reason for that spike is a misguided recommendation.
A number of years ago, the U.S. Preventative Task Force actually came out with a recommendation saying they do not recommend screening for prostate cancer.
The group has since changed that recommendation, but the damage was already done.
Patients were coming to us with much more advanced disease because they weren't being screened early on.
A mistake that significantly lowers survival rates.
And we know if men are screened and we detect prostate cancer at an early stage, the cure rates are around 99%.
It's a simple blood test monitoring a prostate-specific antigen, a test Dan is thankful for.
Never ever thought that it would happen to me and paid no attention to it.
Almost all of my patients have no symptoms at all.
That test now recommended for men around 45 if they're in high-risk population, and all men at 55. Dan got surgery to remove his prostate and has been cancer-free for 3 years.
I wanted to be able to see my kids grow up and stick around for a while.
Dr. Ponsky says another big reason for the uptick in death rates is men in general don't go to the doctor as much as they should, and there's a fear associated with what their test results will be. But despite all of that, he says there's new technology and research in prostate diagnosis and treatment that he is confident will save lives. Jesse Schultz, News 5.